Hello everyone, welcome back to the channel. Today we'll be talking about a very important subject, that is physiology. So in this video, we'll break down the myth that physiology is a very difficult subject. We'll try to ease it out. I'll be talking about why physiology is important, what are the components of physiology, how do you approach it in your first year, what are the important books, and why GUYTON is a must read for physiology. And towards the end of the video, I'll be sharing some important topics. Before we move forward, we need to understand that why studying and mastering physiology is very essential for you in your first year only. So what happens that in your second year you have a subject that is pathology. Now you must have heard your seniors or your parents, if they are doctors, say that MBBS में कोई भी books पढ़ो पर ये दो books तो बिल्कुल मत छोड़ना, that is Robbins and Harrison's, right? So Robbins is the standard book for pathology, and Harrison's likewise is for the medicine. Now, it is also true that no one can completely cover the Robbins or for that matter Harrison's, but we always should know that what are the topics that we should cover from them. Likewise, coming back to the main point, so physiology is important because it not only builds your concepts in the first year, but it also builds your concepts of pathology and medicine. You would need physiology to understand these subjects more efficiently, and these subjects will make up a major part of your MBBS. Okay, physiology also helps in understanding concepts better and helps you ultimately to become a better clinician. So, I hope now you understand the importance of this subject. Now, this subject is divided into two parts, theory and practical. For theory, you'll have approx 9 to 10 units. You'll have to read the books and then your exams will be done. So we have theory, we have two papers, part 1 and part 2. So part 1 will have constitute of general, hemat and a few topics, and the rest will be covered. I guess mostly neuro and endocrine, these are covered in your second. So you can actually go by the distribution of your university of the first and second paper. Now, if I come to practicals, we have OSPE. OSPE is basically your spotters. So a few spots will be kept and you'll have to name them and write one news or whatever the question is asked. So for OSPE, a tip that whatever the instruments you are being shown or the graphs you are being shown by your college, you can actually click the pictures of those and compile and make a PDF of it so that it helps you in the prof. Now coming to clinical examinations. So you'll have to examine a lot of, you'll have to learn about a lot of examinations, starting with your general physical examination. Then comes your motor reflexes, your sensory reflexes, examination of your abdomen, CVS, respi. So likewise, you'll have at least 12 to 15 examinations that you'll have to learn. So these clinical examinations are very important. Again, these will help you in your medicine postings. So for this clinical examination, I would really recommend you to properly see in the class and then demonstrate it among your peers. So this is a very important part, and I guess it constitutes for, if I talk about the prof level, it has a very important weightage, and the questions that will be asked should also be done. So you should be very well acquainted with the clinical examinations. Now coming to hematology, hematology is something that again is very quite important. So over here you'll have to calculate the total leukocyte count, hemoglobin, then RBC count. So again, it is a very important section. You should learn the steps by heart, and those are actually given in your practical books also. Now, a tip, so whenever the teacher is teaching you, you can actually jot down the important points that you feel like can be potential viva questions. And remember not to forget the values. Like you should remember the values of RBCs, WBCs. You know, there are 5 types. So you should remember their values as well. The platelets, normal values in males, females, and you should also remember a clinical condition associated. Suppose you have hemoglobin over here, right? So in hemoglobin, if the hemoglobin is low, then the person is anemic, right? So you should know the values when the person is anemic, the physiological causes, the pathological causes of anemia, and then the standard values of both males and females, right? So and always follow a standard book, that is GUYTON for the values. Okay. Now coming to the last one, that is human experiments. So basically, you'll have ECG, perimetry. Okay, I wrote frog heart over here. So this is basically you'll get graphs and all of amphibians, and then you'll have to answer a few questions. So yeah, so again, learn ECG very properly. ECG is something that every medical student should know, and it is very useful for you, and you will have to learn to interpret ECG reports. Now obviously in your first year nobody is asking you to master reading ECG, but at least you should know how to put the leads, where to put the leads, and basic interpretation of the report. Now coming to books. So I am a person who has always preferred books over videos. Okay, that might not be the case for every one of you, but I study in such a way that I'll have to read the books. So if you're someone who is looking for videos, then I can say that Ninja Nerd on YouTube gives amazing content. So you can look to Ninja Nerd, or there's so I have personally not seen, but my friends have seen, so they recommend Dr. Somin Manna. He teaches on prep ladder, and people say his videos are quite good, but I believe in textbooks more. So now coming to books, so there's a standard books and there are books by your Indian authors. For me personally, Guyton is, uh, I would say I like Guyton more than I like Ganong. Guyton because it explains the concepts very well, and Ganong I feel is a quite concise book. So for me, Guyton, so Guyton is a standard book. And for Indian authors, you can have A.K. Jain, J.K. Pal, Indu Khurana, Sembilingam. So now, okay, I have not read Sembilingam, neither have I read Indu Khurana. I have basically referred to A.K. Jain and G.K. Pal. Okay, so what happens? Guyton is such a book that no one can actually complete it. Okay, it's very tough to be completed, and basically you should understand that you'll have to balance both the three, you'll have to balance the three subjects. So you cannot just shift your focus on entirely one subject. So you should learn to prioritize. Life may everything is about priority. You should learn to prioritize. It would be very easy for you to save time and master what is actually needed. The topics that I would recommend you to read from Guyton would be CNS, CVS, RESPI. Like you should read at least three topics that too very thoroughly, and of course general. So the general is given very good in Guyton, and all the topics are good, but you have to balance, and due to lack of time, I would say that. So if you can complete the guidance, it's very good. I mean, like hats off to you, it's very good. But if you cannot, you should at least read these three topics along with general physiology to build a solid concept. Now, Guyton also has those flow charts, which will help you in exams also. But remember one thing that if you're reading Guyton, please make short notes from the beginning only. Okay, short notes from the beginning only. As you know, what happens because you cannot pass your papers or score very good marks just by reading item. For that, you'll have to prepare your own short notes. Okay. And again, I am a firm believer that knowledge matters more than your prof marks. It's very good that you have scored a distinction, and it's amazing that you have scored distinction, but at the same time, it's very important for you to have knowledge also. Right. Now coming to Indian authors. The topics like GIT. These are quite easy topics, and you can actually refer AK Jain or GK Pal for it. So I used to switch between these two books, and uh, again I would say that read your standard books. Standard books are actually very important in order to enhance your concepts. Do not compromise on them. So try to read guidance जितना पढ़ सकते हो उतना at least पढ़ लो क्योंकि first day के बाद time तो नहीं मिलने वाला. If you are thinking that you can come back, and you know what, I promise you अगर तुम अभी नहीं पढ़ रहे हो standard books, second year के end में या third year में या जब तुम अपना PG के लिए prepare करोगे, you will have a guilt that why did I not read guidance. I'm sure people who are reading guidance उनके concepts बहुत ज़्यादा better as compared to those who are not. So I would really urge you, please go and read guidance. Okay, you can refer to these Indian books. Yeah, now coming to practicals. So practicals, my college was pretty good in my practicals. They used to provide us checklists for various examinations, and they used to provide us PPTs and potential viva questions, important questions. So if your university or your college gives that, then it's good. Otherwise, you can read these practical books. Okay, and remember, practicals are again important. You know what the fun thing is? You will learn how to prick yourself. So nice, learn how to prick them. Please don't faint. Yeah, so follow your practical books. and learn everything in the class. And for clinical examinations, please practice it on your friends. Learn the important sounds. So, like in your recipe, you will learn that there are basically types of sounds, some bronchial, vesicular. You will hear these terms a lot. Please go and read it. How is it? Try to hear, go to your words and hear how does bronchial sounds or vesicular sounds, which one is the normal, which one is abnormal, and always remember to do these clinical examinations in 4 steps. Number one is your inspection. Basically, you inspect, you do not touch the patient over here. Number two is your palpation. You palpate, you touch and see, you look for how the size of the organ and all, you can determine by that. Third is percussion. The percussion cannot be done everywhere. And fourth is auscultation. Auscultation. Make sure you follow this order. It would be very easy for you. Again, physiology is a very easy subject. It's all about concepts, 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 nothing else. So try to make flowcharts because it is that thing that actually helped me. I made a lot of flowcharts and remembered physio like that. So I hope you got something. I hope you understood something about the subject. And I really wish that you have a great first year ahead, great MBBS journey. And I hope you can make yourself proud because that matters a lot. And all the best. If you have any doubts, you can always ping me. I'll surely reply in the comment section. Thank you. Have a great